Parent suicides are putting a spotlight on survivors' guilt and how to support victims. Joining the conversation tonight in studio is Ziv Cohen, clinical assistant professor of psychiatry at Weill Cornell Medical College. Doctor, it would be unfair for us to link any one cause, right, to somebody's suicide. But by all accounts, these people had suffered PTSD. How does that create an environment that makes them vulnerable to depression and severe problems?
Absolutely. Well, I think it speaks to the effects of trauma being profound, and some people who experience trauma are going to develop the full symptoms of PTSD, but a lot of people who experience trauma will develop subclinical PTSD or simply experience profound psychological repercussions of the trauma, and that does place you at risk for things like depression and the tunnel vision that comes with depression that can lead to suicidality. So I think we're talking about the ripple effect, where this unbelievable massive trauma on a community essentially has psychological ripples in every member of that community, and it can create a very difficult problem to deal with in terms of maintaining safety.
As far as maintaining safety, some of the students in Parkland, Florida have been complaining that there's an overhaul of the school administration at that school. In hindsight, would it have been smarter for the school to at least have the same familiar leadership in the school so the students see some continuity?
I think so. As far as that can be done, absolutely. I think familiar figures and familiar parental figures. And it's also very important that those figures are experienced by the students as protective. So if there is going to be a changeover in the staff, it's very important to introduce that to the students, to make sure the students feel they have open access to the new leadership, and the new leadership is really present, sort of boots on the ground with the students in a warm, reassuring, supportive manner.
As far as the father in Sandy Hook, is it possible that the traumatic event of losing your child, no matter what the circumstances, violent or not, is still going to be horrific? Can that show up in years later? I mean, we're talking 6 years later after this?
Absolutely. I think, 6 years later is really a drop in the bucket in terms of losing a child. And what we see with grief, and especially grief around the loss of a child, that is one of the major stressors that a person can experience in life. And really any kind of major stressor does increase the risk for suicide. So particularly this kind of tragic loss, again, leading to what we would call extended grief and depression and raising the risk for suicide.
And so for all of us who are family and friends of people who may be going through something difficult, is it important for us to try to figure, okay, is there something in their background that could make, say, a loss of a job or a failed relationship or any other usual stressor that much more stressful?
I think so. So any further losses can be triggers. I think part of the challenge is that a lot of people suffer in silence and they can seem high functioning on the outside. For example, this father in Newtown, Connecticut, who established a foundation and seemed in many ways to be a model of resilience, but clearly was suffering tremendously inside. And so you have to have a high suspicion of index, a high index of suspicion, a high concern about anybody being able to have symptoms that you may not be aware of, and really encourage people to seek out help or even to present them with help at even the smallest hint of trouble.
And fair to say that those opportunities for help and the opportunities for whether it's medication or therapy are light years beyond where they were, say, 20 years ago?
Yes and no, sadly. I think that we have, in terms of our pharmacopoeia, the medications that we have a lot of options. Unfortunately, none of our medications really have a great indication, a clear indication for PTSD. They seem to help targeting some symptoms of PTSD, but we don't have a magic bullet for this condition medication-wise. And psychotherapies have mixed results. The effect sizes of psychotherapies are rather small in the treatment of PTSD. So I think what's very important is to have a relationship with a provider that you trust so that you can work with them in an ongoing way.
Yeah, trust being the key. Dr. Ziv Cohen, he's a clinical assistant professor of psychiatry at Weill Cornell Medical College. Dr. Cohen, good to have you here. And we ask all of our viewers to take down this number, whether it's for yourself, a friend, or a family member who's struggling. The National Suicide Prevention Lifeline is 1-800-273-8255. It will connect callers to a certified crisis center near where the call is placed, 1-800-273-8255.